Okay, so today I'm going to talk about NICVD and the way NICVD has spread all over the province of Sindh and the services that we are providing. Now, there were two main reasons for expanding the NICVD services. So when in 2015 we realized that two things we were missing. Number one was that the treatment of acute myocardial infarction had changed, and we have to move over to primary angioplasty now. The other reason was that I have been working now at NICVD for 26 years, and over the years we realized that the children that were coming from the remote areas of the province, they were of course born to the mothers who were extremely poor. They had to travel to Karachi, and they would make several trips. And and before anything starts, any treatment starts, their livelihood was finished. They had to sell their animals, they had to sell something. So that made me very sensitive to the pediatric patients. And I would just like to mention here that now we have pediatric services in all our 10 satellite centers. That means now we are providing this service to the pediatric patients at their doorstep. And there are about 50 to 60,000 children born in Pakistan with congenital heart disease. And we have the capacity to see 110,000 patients. So if we really make a circle, in about 2 to 3 years, we will be able to take care of every patient if they are registered with us. Now, if you look at this a busy slide, this shows 10 satellite centers of NICVD. Let me talk about it later on. Sorry. So, how did the transformation of NICVD come around? We established satellite centers. We established 21 chest pain units in the entire province, and introduction of world-class treatment at NICVD. Looking forward. So from a single solo hospital 5 years back, NICVD today takes pride. We have 31 units across the province of Sindh, which includes 10 hospitals and 21 chest pain units. Over 9.4 million adults and pediatric patients have been treated since 2015. And they are benefiting from the NICVD network 24/7, totally free of cost at their doorstep. So in 2014, 500,000 patients were treated by NICVD, and in 2019, pre-COVID era, we treated 2.3 million patients in 2019, single year alone. And post-COVID, 3.9 million patients have been treated in 2019 and 2020. So this graph is showing that how the number of patients rose from 643 to 39 million patients. More than 4,000 bypass surgeries are done at NICVD system annually. More than 1,058 surgeries have been done at NICVD Sakhar. And over 351 bypass surgeries have been done at NICVD at Tando Muhammad Khan. And Larkana we have just started. And hopefully, inshallah, we will soon start NICVD Hyderabad cardiac surgery program. Thus, since we are very selective, the surgical mortality at NICVD Sakhar is 1%. And the surgery mortality at NICVD Tando Muhammad Khan is only 2.3%. Of course, I must admit that, we do very selective cases, and we believe that in the satellite centers, we should be providing services to patients who will come out fine instead of treating very sick patients. If patients are very sick, then we shift them to Karachi. All general services in 10 NICVD hospitals and 21 chest pain units are totally free of cost. 24 cath labs are functioning 24/7 in all the satellite centers, all of them. NICVD Karachi is the world's largest center for primary angioplasty. Pre-COVID in 2019, we did 8,956 primary PCIs only at NICVD Karachi. We have 11 operation theaters working at NICVD Karachi and our satellite centers. So number of surgeries rose, and we also have made a significant improvement in surgical mortality. From 23%, we have come down to 4% now. So what have we done to improve our mortality? There are two very important aspects. Number one is, which everybody can do in their centers, is we created a heart team, appointed a very senior cardiologist who now looks at every case that goes on the OT table. Every case is looked at, a paper is signed, there's a team of 2 cardiologists, 1 surgeon, and they decide. If they reject the patient cannot have surgery. And by doing this simple intervention, we have drastically reduced our mortality rate. There is a thing called medical treatment, and it works. We all know it works. Not everybody has to be brought under the knife. Also, the other thing I think that is important, we brought in a very strong critical care program. Dr. Nawal was here yesterday, and we have not only very strong consultants on the critical care side, but we also have critical care fellowship. And that has made a tremendous amount of difference. Then just want to mention here that we also do minimally invasive surgery now, off-pump surgery, also perform repair of VSRs. So overall hospital mortality has been reduced too. So what did we do? Well, when in 2015, there were no ventilators on the medical side. And it was, in my opinion, I think it was really a disaster. Now we have ventilators in the emergency room. We have ventilators, we have created high dependency units on the wards, and we have 3 CCUs now. So we are providing ventilators to everyone on the medical side, whoever requires. And then, of course, our CCUs are equipped with monitors, IABP, and, of course, trained intensivists. This is how, in my opinion, we improve the mortality on the medical side. So we conduct regular morbidity and mortality conferences, and in these conferences, I realized that there were 3 aspects why mortality was high. Number one, the early invasive, what we call acute coronary syndrome, unstable angina patients, they would come at whatever time in the evening, in the afternoon, and they will be tackled the next day. And many of them would actually be compromised, go into heart failure, and die. So we realized that tackling this issue reduced the mortality tremendously. The second was negligence. Negligence by nursing staff, negligence by doctors, by fellows, whatever. That we became very strict on, and we corrected that. And we said that anybody who walks in with an early invasive program has to be done as quickly as a primary angioplasty. So this also improved. And then, as I've said, that the third one, of course, were the patients who would not survive, or who had poor prognosis, who had very bad condition when they arrived in the emergency room. Now we have started intervention in acute stroke, and we've just started it very, very recently. We've done 3-4 patients so far, and hopefully with the time, this program will also get better and better, and then we'll take it to the satellites also. The number of patients that are coming in is tremendous with acute strokes, but unfortunately, we are very selective in the beginning, and plus lots of them don't meet the criteria. We have at Karachi performed 80 TAVIs. We did in the last 5 years 1,700 PTMCs. And our electrophysiology program is quite comprehensive. We do CRTDs and ICDs free of cost, cryoablation, 3D mapping for arrhythmias, they're also done. We have put in 2,700 ICDs, CRTDs in our patients at NICVD and completely free of cost. So I was told that this was the first pediatric ablation procedure was performed at NICVD in this patient that you can see in the picture. So being a dedicated cardiac center, over the years my experience was that we were sending requisitions across the street in General Hospital, but never got any response from there for consultations. So we decided to hire our own. Now we have our own internist, endocrinologist, intensivist, neurologist, pulmonary. We have full-time subspecialties available. We also have nephrology 24/7. We have dialysis machines available in Karachi and Tando Muhammad Khan and Sakhar. So we do dialysis in those centers too. So this is one thing that has been our dream, and we have been talking about in this conference also, is that, prevention. For prevention, all of us have tried for the last 70 years, but we haven't been able to make an impact, in my opinion. So we realized that it's not cardiologists alone that can do this. There has to be a tripartite, you can say, it's cardiology, government, and the media. If three of these come together, then we should be able to create an impact for prevention of heart disease. We have a full-time department now. Professor Khabar Kazmi heads that department, and he's working very hard towards that. Now the training programs. NICVD has a very impressive training program at this point now. We have training programs in adult cardiology, pediatric cardiology, interventional cardiology, cardiac surgery, critical care, electrophysiology, and cardiac imaging. So how many of our boys have passed exams? In the last 5 years, 121 of our boys have passed FCPS adult cardiology, 121. And 14 have passed FCPS in cardiac surgery, 4 in pediatrics, and 2 in critical care. Post-fellowships, we have people who have done 2 years in interventional cardiology. We have 96 of them. Post-fellowship in electrophysiology, we have 9 of them. And post-fellowship in echo, we have 8. We have 99 students who have passed diploma in cardiology from Dow University. So we are very proud of the standard of our teaching. If you sometimes come down to our morning meetings, you will realize the kind of cases they've done we could have never dreamt of doing those cases, because the volume is high, therefore the boys are really well skilled. Now research, we had started a research department 5 years back, and alhamdulillah it's come out of infancy and childhood, and we are hopefully now the first year of adulthood. First time in the history of NICVD, a paper is being published, written by Dr. Kamran in Circulation, and we will really, hopefully, inshallah, in the future, we'll have more and more publications in the reputable journals. We also provide service to Pakistanis from other provinces. We have only recently collected the data that we have provided in 19 and 20, 70,000 patients came to us from Punjab, 210,000 patients came from Balochistan, 38,000 patients came from KPK, and 9,033 came from Azad Kashmir, and 6,492 came from Gilgit-Baltistan. So altogether, 3,304. We very proud of this fact that, every Pakistani is close to our heart. We are not only for Sindh province, we are for the whole country. Now I'm going to talk about our satellite centers. We have, like I said, we have 10 satellite centers and treating 2.6 million patients so far. This is our largest center in Sakhar. Center in Sakhar has done 9,281 angioplasties and 1,058 cardiac bypass surgeries. And not to mention that they have a very strong pediatric cardiology department that does everything, including invasive procedures in pediatric cardiology. Then Tando Mohammad Khan, I wish I could take everybody there, not very far from here, 2.5 hours to my hometown. 7,339 angioplasties have been done. 351 cardiac surgeries have been done, bypass and others, and currently also pediatric cardiac surgery is being done at NICVD Tando Mohammad Khan. I think the biggest pleasure that you get is by treating the pediatric patients because they are so poor. The families are so poor that it really gives you such a pleasure. And I tell my fellows and my consultants pediatrics से अगर दूसरे जितने भी कार्डियोलॉजी वाले हम लोग अगर हमें जन्नत मिलती है तो आप लोग जो है ना जन्नतुल फिरदौस के मुस्तहिक हो जो पीडियाट्रिक्स के डॉक्टर्स होते हैं जो बच्चे उनकी जो प्रॉब्लम्स को ट्रीट करते हैं. This is NICVD Hyderabad. This is another upcoming center, NICVD Hyderabad. Inshallah, very soon, I'm hoping by end of December, we should be able to start cardiac surgery. Again, 7,000 plus angioplasties, OPDs, echo services, everything is provided at all these satellite centers. I mean, they are full-fledged, but we have to. And even now, electrophysiology, we have many consultants going to the satellite centers of electrophysiology. Similarly, this is NICVD Khairpur, then Nawab Shah, another big center. And I'm very proud of Mitti, because NICVD at Mitti is where, people hear only about children dying. But NICVD Mitti is a fantastic achievement of NICVD, where in Thar, the remotest possible area of the Sindh province, where this poverty is extreme, we are able to provide services to the people of Thar by doing angioplasties, cardiac pediatric services. The angro benefits the most. People who work at the Thar, they also benefit a lot from the centers. Some of their managers have gotten primary angioplasty done. Same another center, we also have a center Liari, because also some patients take some load off NICVD Karachi. We also have an ambulance services are fully equipped and they can ventilators built in and everything. They are clearly state-of-the-art. But we need some more of those. Okay, this is a very unique program. We feel very proud of this program. People of Karachi are extremely satisfied with this program. This is chest pain units. This is a first aid for people coming with chest pains. These are 40-foot containers, and they are under flyovers in Karachi and different areas of Karachi, remotest area of Karachi. There's a diploma holder cardiologist sitting in there. There's a nurse. There's a DFib. There's ECG. Everything is available. This is first aid. If a patient comes in with chest pain, gets an ECG, gets treated, first aid, and then is sent out to NICVD Karachi if they are having chest pain. Acute MI. But if they are not, then they go back home from the chest pain unit. And There's another advantage that I've seen to this. Let's say at this time of the day, most of the children are all gone to work, and there are elderly couple that are at home, and somebody gets chest pain. In Karachi, those who are familiar with Karachi, to drive down from anywhere from work to their parents, take them to NICVD, takes 3-4 hours. So these people are seen, ECG is done, evaluated, and if they are fine, they're told to go back home. This is on their doorstep. So this is a service that we provide at the doorstep. And it's very popular in the city of Karachi. There are 16 chest pain units in Karachi alone, and different areas of Karachi, most remotest areas of Karachi. Those who are familiar with Karachi, they are, here it is, Gulshan Chaurangi flyover, Malir Halt flyover, Qayyumabad Chaurangi, Aya Chandrikar Road, Nagun Chaurangi, Landhi, Karimabad, Orangi Town, Gizri, New Karachi, Musa Lane in Liari, Manzilga. These are the most remotest areas of Karachi. And so we give them first aid for any kind of chest pain. And this program is very successful. Overall, 636,000 patients have been seen by these chest pain units. 13,557 were actually acute MI patients. They saw that many acute MI patients. So this is a very successful program we have because of the size of Karachi, because of the traffic issues of Karachi, because of all these things. And of course, they're all free of cost. Nobody charges anything from anybody at either of the satellite centers or of the chest pain units. Very small part of NICVD Karachi, 5% hardly, has private ward and see some private patients. So what are we doing? In the future, our pediatric cardiology, 150-bedded hospital is under construction by the government of Sindh. And the work had stopped for a while because there was a thing about federal government, provincial government, politics, bureaucracy, whatever. But now, alhamdulillah, it's started again, and we are going to make it a 7-floor building. The other thing is we have a OPD building that's under construction. That work of that has also been halted, but we hopefully will be resuming soon. So our mission is to provide state-of-the-art cardiac care to everyone at their doorstep in the province of Sindh, totally free of cost. Thank you very much.